I've had a quick look over the patient, and in my opinion, he looks very breathless.
I'll make sure that is noted. The patient is a 75-year-old male who has had flu-like symptoms for the last 10 days. Over the last 3 days, he's developed a cough and increasing shortness of breath. Here's his notes. I've just reviewed his notes. It looks like he's never been unwell like this before. He's very breathless and has a cough. Do you think we should do a sputum specimen and full history and examination?
I'm not sure that's a priority at the moment. What do you think? We'll get those done immediately.
I've completed his observations. His new score is very high. He is breathless, hypotensive, and tachycardic with a temperature. What do you think about giving the patient some oxygen and fluids?
Well, before that, I would recommend that we take a full history and examination and refer him to the ICU.
I really think the patient is far too agitated to take a history, and ICU may not be able to get here immediately, so I would recommend we give some oxygen and fluids.
Yes, I agree. I think that you're right.
I have a nasal cannula, a Hudson mask, and a non-rebreather to choose from.
Well, he is mouth breathing, so I don't think nasal cannula is an option. We could try a Hudson mask.
His saturations are quite low, and he doesn't have any respiratory history. What do you think?
I've just sighted a cannula to the patient's arm. What blood should we send off for testing?
I've read some research that we should be using plasma light.
I'm not sure about that. I don't see any reason to change from 0.9% saline. Any thoughts? We now have to decide how much and how quickly to give the fluid. What do you propose? Remember, if you need the patient's weight, it can be found in the patient's notes you were given earlier. He is about 70 kilograms.
I've just asked the patient some questions regarding their history. I've noted them down in the notes.
Now that the history has been taken, what are our priorities for further examination and investigations? Let's proceed. Which investigation would you like to do first? As you've now concluded your history, examination and investigations, what do you think is the diagnosis?
We have a clear story of pneumonia. Let's start thinking about how we should treat this. Okay, so we are thinking that the patient has pneumonia, so we need to treat the infection with some antibiotics.
Well, before that, we should use some guidance to help us decide. The microguide is what we should follow.
I've also just checked with the patient. He has no allergies. Keep this in mind when you decide what should be administered.
Now that the medication has been chosen, how do you want the medication to be given?
Yes, I agree that this is the best for the patient as the drug will be faster acting and it will go direct to the circulation. We can review the treatment later on the ward round.
What dose and frequency of each medication should we use? Now, let's have another look at the patient's medicines and decide what we can start, stop, and continue going forward.
Alright, let's move on to the patient's ongoing treatment options.
We have you on the right treatment now, and we will have to keep you in hospital for a few days. We are going to have a discussion to see what the next steps in your treatment should be.
He looks much better. Well done. Let's decide what the best ongoing plan for him is. The patient is looking much better now.